Hi, everyone. It's Dr. Ozzy here. Welcome to the More Than a Pretty Face podcast. I'm here to answer all your questions about skin, health, beauty, and wellness, and take you behind the scenes of my practice. If you have any questions you want me to answer, send me a DM on Instagram at Skin by Dr. Ozzy, and I'll be sure to answer them on the show. Now, let's get started. Happy New Year and happy new season of the More Than a Pretty Face podcast, guys. We are back.
Woohoo!
We're so excited. We have read and heard all your messages wanting us to come back and record more podcasts. So here we are. We need to take a little break.
Just a little one.
Yes, a little one. And so let's get started.
Yes.
But before we do, guys, don't forget to rate, review, and subscribe. It's because of you guys and your support that we brought the podcast back, and this is all for you, essentially, right?
Yes.
Okay, so do you have a beauty and blemish?
I do. I will start with my blemish.
Okay.
Okay. I had a patient the other day who was being seen for some genital things.
Oh, gosh.
And he said to me, and I couldn't wait to talk to you about it because I wanted to know if you've ever heard of this. He thought that maybe some of his symptoms were from being a tucker.
A tucker? What does a tucker mean?
What is a tucker?
Tucker.
I don't know. I could imagine a lot of things. But
So that's the word he used, tucker?
that's the word he used, and I did not want to ask.
You didn't know what it was? Did you chat GPT it? Tucker.
I think he would tuck his penis somewhere, maybe between his legs, but I didn't want to go into it with him. We listen and we don't judge.
We listen and we don't judge, yes. And, the skin in the genitals is just like skin anywhere else. You should never be embarrassed if you're having issues to go in and see your dermatologist, because we treat that area all the time and people are so embarrassed about it. And I'm like, it's not a big deal. It's part of you. It's part of skin. It's not any different. So back to the tucking situation.
I just
what
never
was the
heard
issue
of that.
okay.
And I just was like,
What kind of
I was the one embarrassed to ask.
Well, what kind of problems was it? What did we? I know I didn't see the patient.
He
but
had a few white pustules on his shaft and
white
just
pustules.
some irritation.
Well, you can get friction rubbing can certainly, that skin is very delicate, and you have to be really careful about using soaps, and people try to get that area really clean, and then it ends up disrupting the microclimate, and they end up with rashes, and then they think it's an infection, where in reality, it's actually an irritation. So you really don't want to do too much to that area. Whether you're a female or a male, it doesn't really matter. I'm not a huge fan of those vaginal wipes either.
I was going to say,
so
we see it a lot in women
you have
more.
to be really careful. You just need water. And eventually when you do shower, things run down our body, and you don't have to actually put soap directly on that area and just be super aggressive. But the white spots, if you do see them in the genitals in men or women, milia are actually quite common, especially on the scrotum in men, and women can get them on the labia. So that's a common finding that we do see. Not to take over your I don't know if that was your beauty or your blemish.
It was my blemish because I felt so awkward because I wanted to ask
I didn't know what tucker would mean.
And then I was like, am I an idiot for not knowing what it means? So I'm glad I'm not alone.
Okay.
I would love to know what our listeners' thoughts are on what that could mean. But I
can only use my imagination.
Same. My beauty is our amazing patients. Oh my gosh, the family that comes in to see us every month.
Yes, they're so dedicated. They drive, I think, 8 hours. They live up in Northern California. And the girl, who's the sweetest thing ever, she is afraid of flying. And she drives ever so often.
Yes.
I mean, very regularly.
And they brought goodies for every single person in the office.
So
They're
sweet.
literally the sweetest people.
They are the sweetest. They brought everybody baskets.
Yes.
Our patients truly become part of our family,
They
really.
do.
And we love that. We love forming these relationships with patients. And over time, you see them have children, then their children grow up, and, it's just amazing being part of their
Honestly,
life.
her son used to come with her when we first opened the
Mm-hmm.
practice, and he was just this little kid. He'd get in the nook with his tablet, watch
Yes.
movies, and she brought him this time. He's grown. He's like 17
I
now.
know. He brought his
And
girlfriend.
I walked by.
like,
He's
whoa.
snuggled up in the nook with his phone watching movies. And I was like,
Yeah.
oh, this is just like when you were little. I was
I
like, do you want a
know.
blankie?
I know. We get to see our patients grow up and, evolve, and that's really cool to see.
It's the best part of healthcare.
Yes.
Yeah.
it is.
How about you? Beauty and blemish?
Well, I would say my blemish is my poor neglected third child, my dog, Alexi.
Lexi.
So, of course, she has eczema, being that her mother is a dermatologist.
Of course that would
And
happen.
it's
to
so
her.
funny because she loves to sunbathe.
Uh-huh.
And I'm like, does she actually know that getting sun between the hours of 11 and 1 actually helps eczema? Because sun UVB rays are anti-inflammatory. So when somebody has psoriasis or eczema and they want just kind of a natural anti-inflammatory treatment, we tell them, 4 times a week, get a little sun, get out there, strip down,
Yep.
between the hours of 11 and 1 and get sun on your patches because it melts them away. It's the same
Yes.
concept when we do phototherapy, which is UVB rays like in a booth. But you can do this in California because we have nice sunny weather year round.
Yes.
So anyway, so she has eczema, and unfortunately her eczema got so bad on her ears that she ended up getting an infection.
Oh no.
So I had to take her in yesterday, and I
Poor
got to take her in
Lexi.
again today to get treatment. But that's an important point, that if you do have inflammation on your skin, such as eczema or psoriasis, you need to get it treated. I'm actually surprised at how many people are like, yeah, I get this rash on my hands, but they don't actually
do anything.
do anything about it. They just sort of accept it. They don't think it's a big deal, but it is a big deal
Yeah.
because that skin, well, first of all, inflammation isn't good for anything, right? So it destroys your collagen, and so it's just not good for your body. But also, if you don't treat it, you can get secondary infections like
Yes.
Alexi did.
Yes.
Because the skin is compromised and it's no longer defending you against viruses, fungus, bacteria. So a lot of times eczema can start off as eczema but then become infections. So
Yes.
anyway, that's my blemish.
Beauty.
And my beauty, I know I already talked about this on the first episode, but I started this. Well, I didn't start it. My daughter started Skin Fairies,
Yes.
which is a nonprofit organization. I'm just so proud of her. I'm going to talk about it again.
Yes.
But she started this 501c that's dedicated to helping youth with skin concerns that have limited resources. So donating personal care goods or skincare products to youth-focused organizations. And so we made our first delivery over the holiday break, and that was really cool.
That was really cool.
So hopefully, I really want in the future, as it grows, I want to also help treat like maybe teenagers with acne scars, or maybe just scars or burn,
I would love that.
whatnot, or just acne. I'd love to set up like a once a month, free clinic for people who don't have access to a dermatologist, because honestly, there's so many people that can't get in to see dermatology just because they don't have insurance, or they, have limited resources. And so I would love to see Skin Fairies also grow into that.
That would be really cool.
So that's my beauty. Well, guys, we miss you guys so much. Welcome back to the More Than a Pretty Face podcast, where we are dedicated to bringing you valuable educational content, because you are more than just a pretty face. You're educated, you're informed, you're empowered to make the best decisions for you when it comes to products and treatments.
Yes.
So, what are we getting into today? We are actually just kind of winging it. I'm going to call this season More Than a Pretty Face Unhinged.
Unhinged.
Because we are not scripting, we are just sitting around talking, and that is going to be the theme of this season.
I really want to know
Okay.
your thoughts on this. Okay, do you remember I think she was like 32, 33-year-old patient we had, and she had a facelift with those really bad scars.
Yes. I think it was earlier this week we saw her.
Yes.
I was shocked
beyond shocked.
that we're seeing more and more of these patients in our office.
Why? Okay, you see it all over social media. All of these plastic surgeons are like, anti-filler, like it's the devil, basically. What is going on?
It's fear-mongering, you know, it's unfortunate and it's completely foolish. So here's my thoughts on this, okay? And I don't think it's like a conspiracy theory or anything like that, but when fillers came on the market, whatever, 15, 20 years ago, the trials only ran for 1 year. Okay, so fillers were stated to last 6 months or 1 year because that's how long the trials were, right?
Okay.
And all these filler companies, there became more and more fillers on the market, and all these filler companies, Allergan, for example, they wanted to get fillers into everybody's hands, right? Because they wanted to get their product into everybody's face,
More
right?
money.
So the more filler they injected, the higher the volume, literally and figuratively, the more profits, right? So it makes perfect financial sense for these guys to just grab anybody who has 2 arms, 2 legs, maybe a brain. That wasn't an important criteria for them.
Not.
They just, had to have 2 arms essentially, and they could be able to see. And then they were qualified to become injectors, and they would train these people. And over the years, it was like you had to go in. It only lasted 6 months, so you go in every 6 months, you get your filler, and the next thing we know, we have this extreme case of everybody and anybody injecting fillers and seeing all these complications, right? Because you really need to have an in-depth understanding of the hyaluronic acid gels. They all have different properties. Some of them are, hydrophilic, meaning they attract water. Some of them are not. Some of them are stretchy. Some of them, are not stretchy. Some of them are firm. Some of them are very, they spread really easily. So it's really an art, but you have to have this very in-depth understanding and medical training and almost the mind of a scientist to be able to understand how it should be placed and so forth. So back to your point now, everyone's like, fillers are the devil.
Right.
And you need a facelift. So now we're going to get all these young people with terrible scarring.
Well, and it seems like they're marketing it as like the do it now so that it lasts longer kind of thing, like the pre-lift or how do
Preventative
they say it? Preventative facelift.
Preventative, yes.
What?
There is no such thing as a preventable face. What is it? Oh,
preventative.
Preventative.
Right?
Preventative
Yeah.
facelift. That's insanity.
You guys.
I almost makes me so angry. I think that you're doing your patient harm. If you're giving a 32-year-old a facelift, you're really doing them a disservice because now they have less skin than they did. And she told us, she was like, oh, it was good for like 6 months, but now it's back to where it was. And I was like, what is? You were not sagging.
Literally.
Like, that is not what you needed. And of course, when you're young, your fibroblasts and your skin is going to be, more robust. So your scarring is going to be worse. It becomes less, predictable. And what are you going to do? You're going to get a facelift at 32.
And then again at
40. Yeah, let's say 45. And then by the time you get in your 50s, you have no skin left. Everyone's going to walk around windblown, and that's going to be like, oh yeah, remember that was the fillers or the devil era of aesthetic medicine where plastic surgeons, were just bashing fillers and Sculptra and telling everybody don't do it and instead come and get surgery. Anyway,
everything in moderation, right?
Everything in moderation,
and
guys.
Skilled injector.
Yes.
Know your provider.
Yes, you can totally do fillers and it will go undetected. But you really have to understand why we would recommend fillers because starting in our early 30s, we lose volume, right? So particularly in the temples, under the eyes, in the medial cheeks, these are the most common areas where we start to lose volume. And if you want to maintain how you look over time, you would replace these as needed. So people ask me, well, how often should you get filler?
As needed.
As needed. And the reason being is everybody loses fat differently. Like some people have, I call them really good fat genes. They tend to hold on to their fat, whereas other people tend to lose it really quickly. And so by the time they're 35, or if you have babies, for example, oh my gosh, women,
Yes.
you know, we can go through all of these changes, life changes, hormonal changes, and that certainly affects our fat.
Yes.
So if you've had, you know, babies or you haven't had babies, you know, that can affect it. So it should be done on a completely customized basis, and the choice of filler, I have to tell you, it's really important. Did you see that influencer Alex Earl? Do you know
my
who
gosh,
she is?
yes.
Yeah, with
About
her
her
lips.
lips.
Yeah.
Yeah.
So I see this all the time. People come in, they're like, I get filler every 3 months at this med spa, but it doesn't last. It goes away. And my lip is starting to curl in. And I keep getting the filler, and by 3 months, it's gone.
Gone.
And my lips are shrinking. They're getting smaller and smaller and smaller. What happens, Lacey?
I've migrated.
I have this
guys.
conversation on a daily, weekly basis with people that come see me from other med spas, trying to
Seriously.
figure out why are they metabolizing their filler. Well, guess what, guys? You're not
You're
metabolizing your filler.
It's moving,
It's moving.
especially around the mouth.
Yes, because we talk, we laugh, we, move our mouth.
We're
and-
constantly moving our
Yes.
mouths, especially us.
especially us, especially women. We talk more. But no, so I call Juvederm Moviderm because it is a very, very common filler that just loves to move. And if you have some Juvederm already that's migrated out of your lip, you put more in, it's very cohesive, so it's going to be drawn to the Juvederm that's above the lip. So what happens is the filler is starting to move out of the actual lip and onto the skin above the lip. And as you put more and more filler in because you think it's dissolving and not staying, then
It's like weighing your lip down.
yes, exactly. So that upper skin that's above the lip is getting fuller and fuller and heavier, and it's going to start to put pressure on your actual lip. And then the edges of your lip are going to start to curl in. And that is what people don't understand, is that your lips are not shrinking because the filler is dissolving. Your lips are shrinking because your upper, skin area is weighing down on your actual lip. And it's incredible. It's puffy, yeah. And when we dissolve it, you can actually see more of your lip. Your lips get bigger. They look so much better.
Yeah, they do.
And people are always in such disbelief.
Yes.
Same with under eye filler. People keep going in every 6 months to get under eye filler, and they're like, my I still have dark circles. I said, well, dark circles have so many different causes.
So many. And I think that a lot of people have a misunderstanding too about the natural creases
Yes.
under our eyes, because so many people come in, I've done filler, I go routinely, I still have hollowness, and it's like,
You don't want to
not
look like a
hollowness.
balloon where you don't have any natural contours. So that, that's the opposite end of the spectrum for fillers. But you also don't want to be like, fillers are the devil, I'm not going to get them, because they can make a huge difference. They can delay facelifts. And same with Botox. Have you seen all those people taping?
yes.
Okay, so I'm getting a lot of questions about the silicone sheets that people are using and tape.
Yeah.
I'm not
Like
good.
right here.
Yes. Well, guess what, guys? Temporarily it might help, but you're going to get a rash. And,
Yeah, I wasn't even thinking about that
and
aspect of it.
It's not going to work. It's not
No.
going to keep you from moving your muscles and causing the skin to crinkle. And just like with fillers, everything in moderation. Let's just bring the pendulum back in the middle,
Please, yes.
where we're not extreme one side or extreme the other side.
Yeah.
And with Botox honestly is one of the best treatments you can do to stay looking more youthful over time.
Or what we call it, tox treatments.
Tox treatments, because there's 5 different types of Botoxes now on the market, but essentially they all relax facial muscles of expression that prevent you from crinkling up the skin. And when you're not crinkling up the skin, you're not getting lines, but you're also not stretching the skin out. I feel like we're not doing eye lifts as early now as we did before the invention of Botox, because people are not stretching that eyelid skin out, right? It's not freezing people
Right.
in time. But too much of a good thing can be
bad.
Bad.
Yeah.
You don't want to overdo the Botox, and whoever your injector is should really analyze your facial muscle movements, because yes, Botox can start to change how you use your facial muscles. It's like any other muscle.
Right.
We want to train it to a degree, but we don't want to atrophy it, meaning we don't want to thin it out.
Or lose it, right?
Or lose it. Yeah, it's like if you don't use it, you lose it, but you can regain it. It's not like,
Yeah. To what point, though? I mean, you have all of these 20-year-olds that are starting neurotoxins.
Yeah, we saw
upper
one
third.
19 the other day. That was,
Yeah.
coming in.
And, then they think that they need to do it regularly or consistently, like every 3 to 4 months. And then, by the time they're 30, they look a little older, maybe.
Yeah. So, I hate to use Alex Earl as another example, but, she's so beautiful.
She really is.
And I think that doing Botox, overdoing it, like going in every 3 months, starting when you're 19, and we're seeing this now. And by the time you're in your, 24, 25, you're actually going to look like you're 34, 35.
Ew.
Because you have really thinned out your muscle. You've no expression, but then you keep going in for the Botox. So the idea is, yes, you want to train the muscle not to move, but after you've trained it, you want to take breaks. You
Right.
want to let it work. So if you're super expressive, and there's actually nothing wrong
Like
to
me.
getting, there's nothing wrong with getting Botox at 20, right? If you already have static lines,
Yes.
then I don't think there's anything wrong with that. But know that you want to do it maybe once a year.
Moderation is key.
Moderation, or a couple
right?
of times a year. But if you're, 30 and you already getting deep lines when you're not even moving your eyebrows, then you want to train them. You want to go in every 3 months. So you see, it's an art.
Yes, it is an art.
And-
My before and afters for Botox are the best. I show everyone.
Yes,
'Cause
you had a really strong muscle movement, but
Very.
we've trained your muscle. But don't I tell you, no more Botox for 6 months for you?
Yeah, I do. I went my whole pregnancy. Even before my pregnancy, I had been on a little break. So I almost went a full year without Botox.
Yes.
And then I do maybe once or twice a year.
Yes.
Yep.
Yes. So, guys, thanks for tuning in. I think that was a really nice discussion that we had.
Yeah, I do too. Thanks for listening. Thanks for having us
Guys,
back.
don't forget to rate, review, and subscribe. And if you're not following us on Instagram, follow us at More Than a Pretty Face Podcast. And my handle is Skin by Dr. Ozzy, and Lacey's is
Nope.
I'm sorry, Nurse Lacey. Wait, Nurse Lacey.
Nurse Lacey.
Nurse Lacey.
Yep.
And don't forget to share this with a friend, leave us a comment, send us DMs. You can also email us at morethanaprettyfacepodcast@gmail.com. Until next time.
Bye.
Bye, guys.